Welcome back to Electrolysis Unplugged. Today's episode is one we've wanted to do for a long time because it addresses an area of electrology that is still widely misunderstood, inconsistently taught, and quite honestly often avoided. We're talking about working on melanated skin. This isn't a specialty topic, and it's not something that belongs in a single advanced lecture at the end of a program. If you're treating skin, you're treating melanated skin. And when education doesn't prepare practitioners properly, what we see instead is fear-based decision-making, over-treatment, or electrologists just opting out altogether. Today's conversation is about bringing this back to physiology, precision, and professional responsibility. It's about understanding how melanin actually functions in the skin, how healing differs, where risks truly come from, and how technique and communication need to adapt. I'm joined by LaTrina Gray, whose voice and experience in this space are essential to this conversation. Together, we're going to unpack common myths, clinical realities, and the changes electrologists need to make if we're serious about providing safe, inclusive, and competent care. This episode isn't about doing less, it's about doing better. So let's get into it. Good evening, everyone. Happy to have everybody here. So I do have a guest speaker with us today, and I want to kind of welcome LaTrina Gray. And LaTrina, I thank you so much for joining, by the way, today. And I'd like for you to take this opportunity to kind of introduce yourself, let us know a little bit about you, what your background is, and all of that so that we can, and then we'll kick off today's conversation.
Okay, sounds great. So hello, everyone. As Joanie said, I am LaTrina Gray, and I'm the owner and primary electrologist of New You Hair Removal Solutions, which is in Dallas, Texas. I still feel like I'm pretty new to electrology, honestly. I started in 2021 and came to this kind of like most of us with my own very successful hair removal journey that showed me that electrolysis was the only way, the main way to get rid of unwanted hair. So yeah, started in 2021 with my electrologist as my mentor, got right into it and discovered the wonderful world of working in an unregulated state, which Texas is one of those. So the challenges there of, finding the community, finding your people, all that. I was able to get things sorted out so that I was able to get my CPE and CCE certifications, and kind of just been going strong ever since that 2021 timeframe. I do have a couple of electrologists that are in kind of the chairside apprenticeship situation with me now. So that's been exciting, but our business is growing, and just happy to be killing those hairs for anybody that comes our way. We definitely see a lot of, we work with a lot of LGBTQ folks, a lot of melanin-rich people, of course, curly, coily hair folks, kind of just a little bit of everyone. So I'm loving electrology. Before I did this, I was in IT, so software development, project management, all that. My degree is actually in electrical engineering, and which is kind of interesting. But I do feel like my work life of 20, 30 years, kind of all the bits and pieces of it have led me to what I'm doing now. I wouldn't have known that, but all of those things really have just, kind of shaped the electrolysis career that I have today.
That's awesome. We're happy to have you. So this kind of leads us into today's topic, which is actually a topic that you're going to deep dive into at the Advanced Electrology Seminar in June. And that is about working with melanated skin. So when we kind of go into this, what we're really wanting to talk about is, I want to start by saying that something that gets missed a lot. Working with melanated skin, it's not a specialty. I think that a lot of us, we tend to go to school and then there might be, maybe it's access to this type of clientele, or there might be a lot of different reasons, but a lot of these clients almost get sold like it's an advanced course, right? So it's not something that you really should only feel comfortable when it's been 20 years in the business. It's something that is normal part of business. So when we're treating skin in general, we're treating melanated skin, full stop, right? So there really shouldn't be this distinction. So where I think our industry kind of went wrong is by labeling this as advanced or optional, because when you
Mm,
do that, you give people permission to avoid it, right? So when it
yeah.
becomes a specialty, some people can just opt out. So practitioners, aren't prepared appropriately for this. And we usually see one of two extremes. There's either going to be over treatment cases because somebody doesn't know how to treat these specific cases, or they just don't understand the skin. There could be under treatment because they're so scared of doing damage
Yeah.
that, or hurting the client, that really then the client is not getting the type of results that they're looking for. So in the end, really both hurt the client. So we need to also look at this idea that certain clients are just harder, riskier. Is that really the case? So, I mean, what do you think?
No, I think you're right. I definitely think that this idea that it is a specialty type thing has put a lot of electrologists, a lot of new electrologists for sure, kind of in the hot seat when it comes to that. And you see this a lot in a lot of our groups, our online groups, where we talk about issues. You've got a lot of people fresh out of school that are really looking for that additional information and do have that idea that it must be some advanced, techniques or something like that. When in fact, it really shouldn't be an advanced technique if your clientele is presenting with it, on the regular basis. So no, I really like the way you frame it. And I think whatever we can do to help every electrologist understand that this is still a very important need, and you need to be comfortable servicing those clients or understanding. If you feel like you have limitations, try to even delve into what that's about and kind of get into it. But yeah, I do like the way you framed it.
I mean, when we're talking about recognizing gaps in education around melanated clients, I think that for me, I tend to see it in insertion technique. There
Mm,
are, and it still happens, we kind of call it like the V technique, but the truth is like the V technique is not just for this type of clientele. A lot of
mm-mm,
people have curly hair, and that
right,
type of insertion is pretty across the board. Not
right,
everybody's got pin straight hair. Doesn't matter what
right.
skin color they are.
That's
So,
right.
it comes down to kind of maybe not hyper focusing. Yeah, I understand that the degree of the curl, degree of the curvature of the hair can be, much more, but at the same
Mhm.
time, the understanding behind how to approach this case really shouldn't be so, mystifying.
Yeah, no, I agree with you. And I guess because I happen to be a melanin rich person, and so on my all of my social media and my marketing, there's my face. And so I think people are drawn to that have similar skin tone and assume that I
Hmm.
have the skills to work with their skin and hair, when in fact I have the traditional electrology training. So that would leave me ill-equipped unless you do kind of what I did, which was just jump way, way deep into it and figure out how to help those clients. I think the V technique, like you mentioned, yeah, that I have quite a few non-melanin rich skin people for whom the V technique, I mean, is what you needed. I'd say most people that I see at least don't have just bone straight hair. Most
Exactly.
hair, yeah, has some type of wave to it where you kind of have to approach that at a different angle. And so, yeah,
Exactly.
being comfortable with that. And you're right. The tighter the curl, the maybe wider that angle is, and all that. But it's not very. It's not a shouldn't be a mystery. So yeah.
Exactly. Exactly. And, I know that the lack of training definitely leads to a lack of, like fear in wanting to
Mm,
take on these cases. I know that at the salon, this happened probably like a year ago. Um, we had a client who came in for a consultation, melanin rich skin, and she had been turned away, I think, from
mm.
3 different salons
Oh my.
because I'm not going to say that it was anything, like I'm not going to attribute negative feelings to that. I'm just thinking that they just were scared of not being able
Yeah.
to do the job that this client really needed
Yeah.
because of lack of training or insert other reason. And so this poor girl comes in and she's just like I've been to 3 places. They say they're going to call to book me and they don't because, that's how we fire clients, right?
Right. Right.
So we just become
Yeah.
too busy, right?
Yeah.
So
Yeah.
it was one of those situations. And I know that for my employee, and I was glad for her. She was on the newer side because I'll hire right out of school. And she had a conversation with her, like she told her, I'm newer, but I'm down if you're down, like that type of
Good,
situation. Like I'm
good,
willing to go for it. Like she
good.
was trained, she knows what to do, but I
Right.
know that this case can be kind of daunting. Do you
Yeah.
remember working on these cases yourself? Like, did you do it during your training or?
It was not during my training. It was when I kind of just stepped out there and opened up my own clinic. Um, and people just started rolling in. But the thing was that there was, that expectation that because I look a certain way, I knew what I was doing, and so I
Mhm.
had to kind of be like your student and just tell people, hey, I'm new at this, but I'm going to give it my all. I'm going to really dig in here and we're going to figure this out because I know that this technology is the thing that works. We just need to basically exploit it and figure out how we can work it with what's going on with the case that's presenting right then and there. And most of those people in the beginning were very willing to, let me try and figure it out. And yeah, it was kind of a baptism by fire. But
Mhm.
because it was that way, that is also why I'm, pretty serious about helping other people not have some of those challenges, trying to like with demystify it and just make sure that, anything that I can share about dealing with melanin rich skin and curly and coily hair and making you understand that it is like other skin and you should not be afraid of it. And what can we do to help you become more comfortable with it? Let's do it. Let me share everything that I possibly can. But yeah, those first few clients, it was a little bit daunting, but I also when I had clients at that point, I had a successful journey myself. So I knew it was a thing
Yeah.
that worked. It was just a
Speaking
matter
from
of
experience, yeah.
right. Just,
On the other side, on the client side, but yeah.
right. Yeah. So yeah.
So, I know that you'll be teaching about this a little bit, but can you tell us a little bit about like what is the role of melanin when it comes to skin physiology and healing as it relates to electrology?
Yeah. So I think the issue that most of us, well, that I ran into personally was that thermolysis was primarily what was taught. And so the other modalities were something that were kind of on the side. And I think I think it's pretty normal for a lot of training programs that we have that they kind of focus on one modality over the other. So for me, it was thermolysis. And I realized this was a part of my own experience too, that I did have the additional post-inflammatory hyperpigmentation from the thermolysis. And so I just kind of had to figure out what's going on there. And it is the melanin that's, with electrology, we know that we are doing injury to that skin, right? We are actually delivering first degree burns below the surface of the skin. That is injury. And so that melanin rich skin is going to produce more melanocytes as part of the healing process. And so, that's part of it. It's so much part of it that I was reading in lots of literature that post-inflammatory hyperpigmentation, PIH, was actually a side effect of electrolysis. And I was like, wow, I know it can be, but why are we delivering this information like that's something to be expected? And I just, that didn't sit well with me. And so I did start researching melanin. I thought about, my own skin growing up and how just walking into the kitchen, I feel like I get a scar. Just even thinking about being in there, it's like, okay, I'm clearly prone to post-inflammatory hyperpigmentation. So anything that's going to be delivering a lot of heat, and if my hair is coarse and curly and it needs a lot of heat, then I'm gonna probably end up with some PIH. But you don't have to. So then we, can we use our knowledge on our training about electrolysis? Like, hey, maybe we balance that time and intensity a little better to not deliver so much heat. Maybe we consider another modality, things like that. So I just kind of started putting that puzzle together.
Okay. I mean, melanin itself, plays a big role in pigmentation and protection from UV lights. I know that sometimes it's a little bit of a myth that somebody with darker melanin skin tones don't have to wear sunscreen, right? Because you got that natural protection. You hear that
No.
sometimes.
All the time. No, that is so not true. It is not true. Yeah, I'm one of those people that, I burn like crazy with the whole thing, blisters and the peeling and all of it. And then of course, after that, the skin sloughs off and you got this nice little sun-kissed look, for a little while. All of that happens with my skin.
Yeah.
So yeah. Definitely a myth. It's not true. I think we're doing a better job now. I think most hopefully, fingers crossed, most people are understanding that we all need protection. But yeah.
And the sun, can definitely aggravate possible PIH, especially if you're in a skin tone that's prone to it.
Right.
Yeah, very good. So, have you ever heard the misconception that melanated skin is more resilient?
Yeah.
Like thicker or...
Yeah, I mean, I think in general, we find this misinformation and disinformation around, melanin risking. And it's not, this is not just, I mean, what we're talking about is dermatological, so dermatology, yes, beauty, of course, electrolysis, all these things. We've got this misinformation. And melanin rich skin is not necessarily thicker and more resilient, and absolutely not. I mean, not that it's the opposite, but it's just like any other skin, which is it can vary from person to person. So we should not assume that those things are true when you see someone with melanin rich skin, that they can take, higher energy just because the skin's darker, or they can, you can, push a little harder, or any of that. No, you can cause damage, and its skin can be very fine and thin and delicate, regardless of the skin tone. So
that's right. No, I mean, it's going to be important to understand that melanin is just a little pigment protein that gets deposited inside a skin cell. It does not really contribute to much else as far as we're concerned, a little bit to hydration, but not really at the skin level. That's more in the hair color. So that's why those black hairs tend to be so much easier than the little white hairs or gray hairs that we encounter. But I definitely, the post-inflammatory hyperpigmentation, I think, is a scary thing for, it's usually fits 3 and above will tend to be kind of your target market there for PIH. And so, and we're talking across different cultures and ethnicities. So it's not independent in one group of people.
Right.
How do you suggest, I mean, aside from, lowering the amount of heat in the skin by maybe trying a different modality, what else do you normally incorporate in your practice, or do you suggest for people to do, especially if they're dealing with somebody that is hyperpigmentation prone?
Well, we first of all make sure that we understand that they are or aren't. So in our initial treatment session, it's always an hour, and we definitely, you said it, in addition to other modalities, but that's such a big part of it. In that initial session with someone, we will try like thermolysis and blend. And of course, watching that skin carefully, you maybe aren't going to see too much happening right then and there as far as post-inflammatory hyperpigmentation is concerned. When we see them back, though, then we look at that right side versus left side and see if we can see any indication of, some minor PIH happening. If we do, then we know right then and there, if we've got a counterpart blend setting that we found for them, which we should have because we try them both in that first session, we're going to lean on into that blend. Other than that, we just definitely encourage people to, if they have a dermatologist that they're working with, we always defer to that dermatologist, make sure that they communicate to that dermatologist that they are getting electrolysis. So we know the different types of products and things to stay away from. And then we just say that, let's give electrolysis a try and see how it's going. Let's really give it a real try. Let's try a couple of months without introducing anything else so that we can make sure and isolate if electrolysis would be causing any type of PIH. We've already got them maybe on blend if they're prone to it, and then we're giving it that time so we can really judge it. We're having them come in and doing very thorough skin examinations. We encourage them to, send us photographs all in between sessions.
This episode is brought to you by MEEC, the Maryland Electrolysis Education Center. MEEC is committed to providing comprehensive training and continued education for electrologists at every stage of their career. Find out more about their programs at mdelectrolysiseducation.com.
So, but we try not to be too too concerned about it because even with a gentle electrolysis treatment, you might, again, we are causing injury below the surface of the skin. So the skin is going to repair itself. With that repair, we're going to see something happening. Some of that could be very minor PIH. Let's see if the skin is able to resolve itself. Sometimes we'll try to have their sessions spread out a little bit more so that the skin has even more time to recover. So you know what? It's really, it's very, very case by case, very customized, but just kind of really paying close attention to that client as an individual.
That's right. And you were talking about, during the consultation, you were trying out different things, and then you wanted to see on the follow-up how the skin looked. And it kind of brought up this whole, it looked fine when they left idea is not the perfect end all to essentially to safety, right? It doesn't mean that just because it looked okay in the moment that there's not things happening physiologically in the skin afterwards that might pop up later. There's things that such as that show up only during delayed healing.
Right. No, you're right.
PIH is definitely one of those. That kind of brings back that, for those clients that you think are more at risk of something, especially like post-inflammatory hyperpigmentation, how doing that test batch during consultation is probably a safe thing to do, because you kind of want to see how the skin reacts, as opposed to just going for it, doing a massive clear up, and then potentially triggering, a pretty bad reaction.
Yeah, that's true. And I guess let me clarify too. So in our consultation, we're not doing any treatment during the consultation. Mm-hmm. It's going to be that first session that's going to be an actual treatment hour. It's an hour where we're going to do some blend and some thermolysis. I mean, we're doing a lot of talking through their details in their registration forms and stuff like that in that first treatment as well. But this is after we've had the consultation, and this is when they're coming in for that first treatment.
Yeah. So as we're kind of getting into, when we talked a little bit about what triggers PIH, so usually that risk comes from trauma. People will get PIH from bad sunburns, from pimples, from scabs and cuts and different things. And so there's a lot of different triggers to it. Electrolysis triggers PIH sometimes because, like you said, we're causing trauma in the tissue, and trauma stimulates melanocytes. They create that melanin. They dump that melanin in those keratinocytes, and boom, you've got a little spot of PIH, right?
Right.
So do you believe that overtreatment is the most common cause of PIH for electrology?
Well, definitely wouldn't be under treatment, but I think it is the lack of considering other modalities. I think I'm willing to bet that 9 times out of 10, when we're running into that PIH situation, it's a thermolysis case. And we use everything. We use thermolysis, blend, and galvanic at New U. But most of the times it's thermolysis when we have had that intensity a little higher, when we maybe could have dialed that intensity down and our time up. So it's not quite over treatment. It's just maybe you could make some minor adjustments, but look at that post-inflammatory hyperpigmentation and maybe make a tweak.
Yeah.
Now, so I don't go ahead.
No, go ahead. Finish up your thought.
Yeah, I was going to say, I don't think it's an automatic, over treatment. And it's like, well, I mean, I think it's maybe modification time.
Yeah. And that's an important point. When something doesn't go quite right, it doesn't mean automatically that you're doing everything wrong. Right.
Right.
And so electrolysis is an art, and it's not easy. We kind of talk about this over and over again. There's so many micro decisions that we make just for a single insertion, and we do thousands of insertions sometimes on one client.
Right.
And so what, there's a lot to take into account. And we're dealing with human skin, with physiology. And so it's difficult. And so sometimes, it's not that you're doing something wrong per se. Your levels could be perfectly run of the mill, normal energies, normal amount of work, and they would have been fine for someone else. But for this client, maybe it was a different strategy that we needed to tackle.
Yeah.
let's talk a little bit about keloids versus hypertrophic scarring. So
Okay.
I know that a lot of the textbooks, will talk about keloid scarring as a possibility. Um, we've also talked about in the field that we've never seen a keloid scar caused by electrolysis ever. And electrolysis has been around 150 years.
Right.
But that being
Right.
said, can you explain a little bit behind what causes keloid scarring and why we might want to be a little bit more cautious or why that might be an issue?
Yeah, I mean, as much as I can. Again, I am not a dermatologist, you guys.
No.
I'm not a dermatologist. So, but it's one of the questions that we ask on our intake forms. If your skin is prone to keloid, do you have any keloid? And then if they say yes to that, we ask if it's an area they wouldn't mind showing us. And of course, we want to know if it's in the area where they have the unwanted hair. Very When we do see them, well, I haven't seen them in the edge, in the area where they're wanting to remove hair. But it is very much a hereditary or genetic, characteristic of that skin and that skin's healing, the skin's, overhealing. And it's usually very deep scars, which again would explain why you don't typically see this from electrolysis, like at all. But if someone's skin is prone to that, then you just want to make sure that, they're aware that if they're prone to it and we're working in that area, their skin has a propensity, not even a tendency, but a possibility that their skin could do that. However, where we're working is not going to go into the levels where keloid scarring even begins. But yeah. So, I mean, because it's a skin thing, we do have to acknowledge it. And it's good to know, especially if it's in the area where you're working. But I think you do have to then let people know that keloid scars that's a very, very deep skin condition. We're not in that area with electrolysis, but you have to tell people. And I've found that too. Most people that have keloid scars know that their skin can or has done that at a time. So they really don't seem as concerned as the statements in the textbook. Or I don't know. So I don't know what that's about. I don't know if, was there some type of case,
I think it was, a lot of things are like, in theory, this could happen. And it's true, because since we're triggering the scar making process when we're doing skin healing, there's always a chance that, for people that are prone to keloid scarring, that it could just go out of whack. But like you said, if it's something that happens in the deeper layers of the skin, we're not even going to that depth, then, that's probably why we've never triggered, in the history of electrolysis, unless somebody's really overdoing it, we've never triggered a keloid scar on somebody.
Right. Yeah.
So definitely important that's why it's still in the intake forms. I think that's one of the big things. If you buy a pre-made intake form, it might have a question like that. And, a hypertrophic scar is different from a keloid. A keloid tends to grow and grow and grow, kind of out of control. A hypertrophic scar could be a slightly elevated scar, but not a keloid. And so that's a different case completely.
Yeah.
Are there areas on clients with higher levels of melanin in their skin where you're more careful? So you kind of pay more attention to your treatment, to settings, to heat, and areas where you're maybe less, concerned about it?
Yeah, I would say your thinner skin area. So definitely like the upper lip, I think is a little more sensitive, a little more if you are prone to issues with the melanin in your skin. Then that upper lip, it's probably, but again, isn't that with all skin too though? Like you would not use your same, chin and jaw settings when you approach the upper lip. That skin is thinner, finer. I think on the body in general, if you are prone to post-inflammatory hyperpigmentation, it's going to be more apparent on the body skin. But anytime you go below, you're dropping below your neckline. So up here and in the chest area, that skin is very, very delicate and thin. So you're going to be a little careful there. Yeah, legs, the shin area. That's that thinner skin where you're taking your time and being a little bit gentler because, this is something that you would not see right after treatment. This is definitely something when they come back in, you've done some body work, and you've been going to town on their chin and everything's great. They come back in a week or two, everything looks fine. Move on to some body work, and you're just having all these little marks and scars. Well, that skin is thinner. I don't know. You don't have the same fat deposits in the area. So for whatever reasons, but yeah, I would
mean,
say
the hydration is less, and skin keratinization is slower usually, and so marks will stay longer for sure.
Yeah,
and dry skin heals slower. Usually, you'll have oils on the face, and so that definitely makes it a lot easier.
Yeah.
What about if clients come in, especially curly hair clients that come in with all those ingrowns?
Mm-hmm.
How do you tackle that?
We will, if we can. So first couple of sessions with a client, and we'll tell them, like, we don't know you like that yet. We're not going to go digging, but eventually we will, and I tell them, we'll start with, hairs that we can see just below the skin. We'll go ahead and get, lift those hairs out and treat them. And as we progress through their journey, of course, ingrowns will be actually less and less, but we just kind of get a little bit more comfortable with them, and we will dig maybe a little bit deeper to go after a hair. But we definitely don't just leave them. I've read some things that say, only treat the hairs that are, completely erupted from the skin. And actually, I mean, they're in there for the relief of the ingrown hairs. So if we can see those hairs, we're going to try to fish them out and treat them. Yeah, so that's something where I think, some of the things I've read are a little bit counter to our approach. We will go after a hair that's below the skin and try to release that hair and then treat that so that we can try to, reduce the situation with ingrown hairs. That's why they're coming to us, was because of the ingrown hairs. Yeah. So we'll go for ingrowns.
I think that when we're treating clients with curly hair, honestly, this is where the skill really shows up. I think that treating these types of clients are about precision, not about, the amount of energy that you're putting into the skin. So, and precision means lower parameters to be, in the end. And so that's going to be the most important part. Energy definitely has to match tissue response. So we have to make sure that we're understanding what time and intensity does to tissue, and what the different modalities and how they work, and which one creates more heat trauma versus another, which is why if I guess listeners aren't really understanding why you're going one direction versus the other. Thermolysis creates heat in the tissues, and heat will definitely contribute to stimulating those melanocytes. And the more heat you put in the area, the more chances you have of creating PIH. And so a modality like galvanic does not create heat, it creates lye. So there's actually no thermal change in the tissues. There's still trauma, and trauma can still cause hyperpigmentation. So don't think that it's an end all, and don't think that it's going to fix all your problems. Your proper insertion still is necessary, but that's kind of what you're leading to, is just removing the heat component of the modality itself. Now, when we're doing blend, there's thermolysis in there. So there is low heat generated anyway. Just not to the levels of just straight thermolysis if we're using that for hair removal.
Right.
So I think that, it's important if you're kind of getting into this and we're talking about how to tackle a case like this. If you've had no formal training on it, if really all you're doing is listening at home and kind of listening to us talking about it, I talked about, obviously, precision is going to be important. You talked a little bit about the type of modality and slowing things down so that you can make sure that intensity is not too high. What about probe selection? What do you think?
Yeah, I think it's still, I think I lean on the basic education with probes, which is size your probe to the hair. I think that's going to be, the best advice, no matter what's going on with curvature of the follicles. I think that is still very important to use the appropriate size probe sized to the hair. So, my clients run the gamut. You can have the curliest, tightest, coiliest hair and it be super, super fine, right? So I'm going to still approach that with the smallest probe possible. So for me, I'm still following that guideline of sizing probes to hair.
Do you work with insulated probes when you're doing these cases?
I do. Yeah. So when I'm doing thermolysis or blend, then I've got the insulated probes. When I'm doing straight galvanic, then I've got the stainless steel probes.
Different. Yeah.
Yeah.
So what about treatment planning? Because one of the ways that I approach this, for example, is I know that especially with curly hairs, the degree of curvature, so how curly it is underneath the skin. I don't care about the outside of the hair because that's a visual guide for me to understand what's going on underneath. But the degree of curvature under the skin is actually, it gets more curly as the hair enters its later anagen stages. And so I think it's really important for me to schedule the clients to come in often so that I can catch the follicles as straight as possible, essentially. What do you suggest?
Yeah, that's interesting. I think treatment for me regarding curly coarse, it's really, I think, I'm just thinking about like my current cases. My average client is like someone who's been a plucker for life. Treatment is usually as frequent as possible up front, right? Front loading, pretty heavy because we're of course trying to get them to stop plucking, and so they've got hairs coming in so often. So it's really about trying to catch. Yeah, they would be in the early. Yeah, that would be early anagen hair too. But it's really about them getting them off of that plucking habit. So come in and see me as often as you can, so that we can get as many hairs treated as possible, so that you won't be as encouraged to pluck. Yeah, but I don't think it's a good point about how straight the hairs are depending on the stage. That's interesting. That's really interesting. I don't think I've ever really thought about that in the treatment plan. It really is about trying to stay on top of the growth of the hairs, so trying to attack hairs and get them off of a plucking habit. Or it's almost an addiction.
Which will go hand in hand in the end. If you catch them in early anagen, they're not going to have time to start getting bothered by it. So you're probably doing it anyway, even if you're not thinking about it, the same way.
Right.
What about aftercare? What do you recommend?
Simplicity. A lot of my clients have been down the road of products and chemicals to fade dark marks and all of that, a lot of retinoid use and all. And so we try to help them understand that once they start electrolysis, that this is a time to just try to let electrolysis do the heavy lifting, do all the work. Because again, we've got them front loading and coming in to see us very frequently. So they really don't have safe time to be using retinoids and acids and things. So we really dial it down to simple. So your very simple and gentle washes, witch hazel, basic things. And I'm sorry, I was distracted. But basic face washes of witch hazel, and then a routine of maybe if they were washing their face once a day, let's try it twice. Let's definitely keep your moisturizer, your sunscreen. Again, super simple. Let the complexity be the electrolysis that we're doing. And I know that a lot of people have a lot of different, skincare products that they might recommend to go to coincide with electrolysis, but we really don't. We really are saying, let's keep it extremely simple. The other reason we do that though, too, is because we're really trying to see what role electrolysis is playing in whatever's going on with your skin. And if you are doing a lot of different products, in addition to electrolysis, it's hard to kind of isolate, what's happening. So simplicity, basic.
Yeah. I know that there's a lot of products out there. Anything that we recommend post-treatment has to be done on top of skin that essentially has an injury, right? And so we have to stay away from a lot of the harsh products. And actually, somebody dropped into the chat here what I was going to bring up. And so, what are your thoughts on tyrosinase inhibitors?
Yeah, I've read some of the things about, starting those a good 2 to 6 weeks before your electrolysis appointment and all. Again, I'm not a dermatologist, but what I do know is this: if you can successfully kill the follicle and remove that hair, the skin can go a long way to repairing itself if you have enough hydration and moisture. So hydration internal, moisture external. So you can let the skin be skin, so that you would not have to inhibit the skin from doing what it normally does. That's my take on that. And I mean, and I think to tell someone to be on a regimen with the tyrosinase, it's hard to say, the inhibitor. It goes beyond my expertise. So I do not recommend that unless you have that advice from your dermatologist, because I do know that the skin can repair itself if given the chance to. Yep. So,
I mean, essentially, a product like that would just kind of block the melanocytes from overproducing melanin, right?
Right.
A lot of this ingredient will be in some post-care products that people might use, like post-laser. And so using it post-electrolysis could too. But I agree with you that sometimes it's about limiting the amount of trauma that we're producing to begin with. I've never been overly concerned with hyperpigmentation, mainly because it's transient anyway.
This season, Electrolysis Unplugged is spotlighting our groundbreaking research project. We're working on bringing legitimacy, data, and recognition back to electrology. If you're a practitioner ready to contribute detailed charting and client outcomes, or a student interested in learning the process, visit electrologycoalition.com. Look under research and get involved today. Together, we're writing the future of electrolysis.
And so a lot of it, clients will come in having a ton of pigmentation to begin with because of whatever ingrowns and tweezing and everything else that they're doing to the area. So whatever electrolysis may cause, and we do try to limit that, is not going to be, much seeable.
Yeah.
But I mean, these products exist. I have never really done a thorough regimen of that, like a recommendation where my clients are always on it and using it.
Yeah.
And like you said, like, how would you know that it's not the body just fixing itself normally and it would have done that anyway? Versus, a product that's just kind of, they think is helping along, but is it? Moisturizing the skin, like you said, is I think the most important. Barrier repair is huge. And that also helps with, the natural keratinization process. So the skin renewing itself naturally. And that's kind of what you want it to do. So sometimes just let things be is probably best.
Right.
Right. We've got another question or comment here. So as someone that wasn't properly trained in blend and galvanic, and in a market where 99% of electrologists are thermolysis operators, what tips do you think can make a difference in PIH for those of us that are currently limited to thermolysis? Would it make sense to space appointments out further to allow skin more time to heal between appointments?
Yeah, I definitely, skin recovery is a good one, because you definitely want to see what's happening, and then you don't want to re-injure, on top of injury that's already there. I mean, I think like Joanie was saying earlier, any PIH that is going to be caused by the electrolysis, it's superficial, right? And the skin is going to recover. But the more time, that's a great plan to follow, is to give that skin time to heal and recover. Yeah.
So we're going to shift gears a little bit. Let's talk a little bit about communication, trust, microaggressions in the treatment room that might be relating to this type of clientele. Have you, what sorts of examples have you heard about or encountered yourself that you kind of say, this is how this should be handled?
I think so. For me, I usually get a lot of people who have seen other, have gone to other electrologists, and I think the biggest thing that happens is probably the turn away, maybe the sudden no availability, that whole thing. And And I guess I'm kind of split on this. I tell my clients like, well, on the one hand, thank you to that electrologist that didn't try to use you as a guinea pig. Maybe what we need to do. So that's, information I give my clients when they come in, telling me, that those are the experiences that they've had. Electrologist to electrologist, I say, let's lead with honesty. So if you are concerned with treating someone, I think that you maybe need to try to articulate that concern and be honest and upfront with people about what you feel like your limitation is. I think that we do more things like this, widen our network of electrologists with different expertise and experience, so that perhaps you can refer people to other electrologists that maybe are more comfortable with a situation than the one that that you're facing. And it's about microaggressions and things like that, but really just in general. I mean, if you are uncomfortable with something, I think it's okay to say that this is not, the area that I was trained in or feel most comfortable with. And I really think that maybe you can reach out to so-and-so and whoever, and maybe try them, something like that. But the turn away seems, I think people have come in telling me that they've been told by electrologists that their hair is, is not going to respond well to electrolysis. And I'm like, well, that's the only thing that is the thing that it will respond well to.
That's not true. Yeah.
Right. So, yeah.
I guess if we have clients that are listening to this episode specifically, and you kind of see yourself as that patient, just know that it works on all hair colors. It works on all skin colors, and you can do it everywhere. So I remember this like lives rent free in my brain. But a long time ago, I was at a conference and I was teaching. I think I was, it must've been like one of the AA conferences, and I would do demos all the time. And so there's, it's a time for networking and everything like that. And this one electrologist kind of came up to me, and she just kind of pats me on the shoulder, and she's like, "Don't you just hate it when you just can't help them?" And I'm just like, I looked at her and I was like, huh? Like, what do you mean?
Right.
Like, there has never been a case that I could not do. The only time I can't do a case is when the person just leaves and they are not there physically for me to do.
Right.
That doesn't happen. If you're, if that was unfortunately your experience, just know that yes, it does work. You just keep looking. You're going to find the professional out there that is going to be able to deliver for you, really.
Yes, that's right.
So let's talk a little bit, some scenarios. So what do you do when a client comes in and they've been previously like injured? So they went somewhere else and you're kind of saying like, thank you to this electrologist for not using you as a guinea pig. Like, but what if they did?
Yeah.
So how do you handle that?
So if they're brave enough to come again, I thank them for not giving up on electrolysis. I let them know that, regardless of the experience that they had, that it really truly is the thing that's going to work, and that they found the place that's going to work to make it work for them. And that, they're going to be treated like an individual, and we're going to figure this out. And that it is something to figure out, and that maybe, not that they were hurt or injured. Of course, it wasn't intentional or nefarious or anything like that, but
it rarely is. Yeah.
Right.
It's rarely
It's
intentional.
It's not intentional, but that they found the place that understands that this work everyone in all hair. So we're gonna figure this out. Yeah. But no, I do. I those people that try again, especially try after injury, they deserve to be applauded. They know too that they either read it or whatever. They just believe that this is the thing that works. So they're giving it a try again. So we love on those people and take our time with them. And then of course, after a few sessions with us, and we've got the all of the audit trail of pictures and all that, we celebrate.
Mm-hmm.
Yeah.
That's good. You take do you have like pictures of like success stories that you're showing some of your clients at consultation?
I do. Yeah. One of the biggest ones is my own, but yeah.
Okay.
Yeah. Yeah.
You have that person's consent pretty easily, I think.
Yeah. Yeah. But no, we do. We definitely share success stories.
That's good.
And yeah.
what do you do when you've got somebody that is understandably very skeptical?
You know, so they're skeptical, but I'm not pulling them in off the street. They're making that choice to walk in there. So on some level, they've got some hope or something.
Mhm.
So yeah, so we just kind of lean into that and say, let's give it a try. Let's give it, 4 or 5 sessions. Let's give it, or just little baby steps. Some people I'm really holding their hand, for a whole year. It seems like, yeah.
Yeah.
But yeah, we just take those baby steps with folks. But
I
no,
guess
we have
you make a good point though. You didn't drag them there, and so there is something that brought them in. You have
right,
to lean on that. That's, I think, something
right,
important to remember, because I think we always get the client that's like, convince me this works. So it's like, well, clearly you think it does, because here you are.
right,
So,
right, right.
let's go from here in a
Yeah,
more positive way, please.
yeah, yep.
So, how do you repair trust when outcomes are slow or complicated? So some cases can be quite difficult, right? And
True.
you've had some cases where it didn't go quite as planned.
Yeah. I think in my experience, the difficult cases that I've had, these people know that their case is difficult and challenging. And so I've been surprised and impressed with some cases where the people they're sticking with it. They will stick with it. So, it's just a kind of a mode and a vibe that, like, look, if you're here, I'm here. We're just in it together. And I don't know how they trust that, but they do. I think I don't know, that sincerity just comes across. It comes through, and
I think when you believe in what you do, and
yeah.
clearly you do, because you're your own success story,
Mhm.
it the way that you present this to people during consultation, it comes through in just how you're
Mhm.
talking about it.
Yeah.
I always kind of talk about how, like, your consultation is somewhat your sales pitch. And if you're
Yeah.
not believable, then, people are not going to give it a go. That you should look at your conversion rate, like people that are coming through. Are they booking appointments? And then if they are they sticking with their treatment plans? That says a lot about how much trust they have in what you're saying, because the truth is we're asking them to give us money almost on a weekly basis for like a
Yeah.
year and a half, right? It's
Right.
not quite
Right.
that intense, but I mean,
And so, yeah.
it's a big
Yeah.
ask,
No,
right?
you're right. You're right. You're absolutely right. I mean, I think track record type things help a lot. Um, having that actual evidence
Hmm.
um, of success. Um, I guess, man, yeah, those initial pictures and people having people's permission to show those things and people seeing themselves in that. Um, and I think then there's that it is so, especially for women dealing with unwanted hair. I mean, gosh, it's the shame of it all and all of that. And just half the time I feel like, a therapist,
Yeah.
because people are really opening up about the embarrassment of it and all that. And we just make it a very, very safe space and make our clients feel that we understand because we do. It's not just, we're not faking it. We
Exactly.
really know what they've been through and what they're
There's
dealing
kind
with.
of a buzzword that, we talk a lot about with gender affirming care, but I think it could definitely apply here. And you're kind of, case in point with what you just said. But, trauma informed care, isn't just for clients who tell you they've had trauma. Really, it assumes that history exists, even
Mhm.
when it's not really spoken about. And so you're talking about people coming in with history and trauma associated with their facial hair. And
Mhm.
so women that, have maybe had, who knows, like decades of issues and problems and infections and ingrowns, and, people saying things about them, or, whatever it is, it's are kind of coming in with with that history.
Right.
So do you think sometimes, it's really important, I think, to create a safety space, like a safe space where
Mhm.
people can be seen, where people can be believed, and where honestly, they feel safe returning for long-term care. I think that's kind of the most important.
Yeah. No, I think you're right. I think you're absolutely right. And I think we do that. I think that's actually one of the most rewarding things about what we do is that you can see that that's the impact that you're having on
Yeah.
people's lives. I mean, so many of the reviews and comments, it's, this is life changing. I mean, people, you don't just throw that around. I mean, this is really, electrolysis for so many people is actually life changing.
Oh yeah.
And yeah, that's a big deal. So we definitely don't take that lightly. And I think that our clients feel that. And yeah, we're happy to be, on this. We call it a journey. It is a journey.
And we are on the journey with them, like I know where they're going to be in the year and a half. And so I'm usually more excited than they are up until they kind of see it for themselves. And then that's when, that they believe really. And Emily kind of seconds this. She wrote in here, when the client sees the results, the progress, that they come back, they're going to be motivated to keep coming.
Yeah. Yeah. That's true.
There's another question here from Eileen. So what's your advice for those of us who want to use blend or multi-needle galvanic instead of thermolysis when the client may have had only thermolysis and is used to faster clearing?
Yeah, that faster clearing thing. There's like some psychology around that to help people understand that it's not a race, it's a marathon, right? And that I think, unfortunately, our friend Laser has kind of not helped us there, because I think people get it in their head that, fast is good, faster. The goal should be this session that all of this is cleared. And it's like, that's not it. I take people back to the part of the consultation where we talk about the hair growth cycle, in stages, and that it takes time. And I just kind of reiterate that we are working with, stages and cycles that the body is doing. We can't, we're not magicians, and electrolysis really is not the thing that's going to do that, not fast clearing and really, kill the hair. You may walk out of here with something called a clean sweep, but what you really want is an effective kill as possible.
Exactly.
Yeah.
There's a big difference. I mean, I sometimes will tell them, like, especially having a school, there's some students that, go faster, and usually they're supposed to go slow and do a good job because I want an effective treatment.
Right.
And so sometimes, they're working fast, but they're tweezing all the hairs, and it's just like, listen, like, the speed here doesn't help you because they can stay home and pluck their own hairs. Right. And so going fast at the expense of your precision, of your technique, of your skill
doesn't
really get you there any faster. So like you're saying,
it's
a marathon, it's not a race.
Right.
Eileen said that because she has a school too, that's what she tells them. But some of the students think that I think are a little more tentative about asserting that.
Yeah. Yeah. Well, I don't know. I think here in Dallas, there's some clinics as well that really tout that speed above the, like, it's like,
they'll make their branding about it, so but yeah, it's okay. I mean, then they're not competition for you, if clients are seeking that, they'll find their place for that, and that's okay. Right. I think there's enough clients for everyone out there. So you're going to find the ones that fit you. And if they want somebody that does thermolysis, I'm sure there's plenty of options out there, and they can definitely go there.
I think there was a part of someone's question too about being trained at thermolysis, but wanting to maybe encourage clients to use a different modality like blend or even multi-needle. But the client is concerned about the speed. I have incorporated the whole kill rate discussion in my consultation for the clients that can handle it, deal with it. Those consultations can get to where it's like too much, like for some people.
Yes.
Yeah.
If the eyes glaze over, you went too much.
Gone too far. Yeah. Yeah. But I do because we really do. We do all three modalities. And there's different times and cases to use different ones, but I will tell people that they have different, I believe in, I subscribe to the kill rate theory, and that thermolysis has the lowest kill rate. It's the fastest for us to do, but it does have the lowest kill rate of, and I use the numbers from one of the books. It's like 25%, whatever it is. That blend has a 50% kill rate, and then that the galvanic has the 80 to 90% kill rate. But it's the slowest to do. So I try to help them understand that there's just, if we're talking about, if you don't have any contraindications to stop to galvanic or whatever, but So if you could, if you were a good candidate for any of them, then it really becomes about, the goals with this. And sometimes even for my blend or multi-needle clients, the event is coming up, like, in 2 weeks, the vacation or the whatever, and we just want to clear as much hair as we possibly can. That's a time for us to jump back over to thermolysis. So they all have their uses and their benefits, and they all work. I only had thermolysis, and I was definitely someone who probably should have had some type of galvanic, either blend or straight galvanic. But I had thermolysis and it worked.
Yep. Here you are, and it's gone anyway. So
yeah. So no. So if it's, I guess, if you can think of the reasons for why one of the other modalities would be better for them. And, so I'm thinking like, maybe it's a client that has really deep rooted hairs, coarse, and we're doing thermolysis. So we're having to use quite, a high energy level to get those hairs to release. Well, maybe blend would be better. If they can understand that, why would blend be better? Well, you wouldn't have to use as much energy, wouldn't have to use as much heat. So you can try helping them understand the reasoning. But some people really are going to just want to leave with as much hair gone, and it does come a point to where, if they're willing, they want to pay for you to be doing thermolysis for forever, ever and ever, then okay. I mean, sometimes it really is just give them what they're asking for, but try to help them understand, first you have to understand the reasons for it, and then try to bring them along to that. But
very good. As we're pretty much done, I kind of have like one little, if you can leave the listeners with just one change that they could make this week that would improve safety for melanated skin clients, what would it be?
Probably for my thermolysis users, let's see if, well, first of all, if you think there's evidence that the electrolysis that you're doing may be causing a little bit of post-inflammatory hyperpigmentation, let's try to kind of do the seesaw with that intensity versus time. It's probably the intensity that could be dialed down and the time maybe just a little bit higher, and kind of see if that doesn't make a difference for you. I would say also maybe you said one thing, sorry. Don't ignore it.
Okay, you can give two.
Okay. Don't ignore it. If you see something, do something about it. Don't ignore it. Don't just accept that it's a byproduct of electrolysis. And maybe try to investigate and figure out if there's a little bit of something you can do. I think it's the one quick thing is not to switch to try to become a blend operator when you're a thermolysis operator. I think that you should definitely, do not abandon what you're comfortable with, but maybe slowly start to read about the other modalities. Yeah. Yeah.
Very good advice. Yep. Education. That's what it comes back down to, right?
That's right. That's right. Always.
That's right. Thank you so much, LaTrina. This was a great conversation. I hope everybody has a great evening. That's right. Emily says, practice, practice, practice.
Yep.
And we'll dive way deeper into this when we are in California for the Advanced Electrology Seminar in June. And by the way, I believe that tickets are going to be live for purchase on Thursday. So today's Tuesday. So Thursday, we'll be able to start purchasing for the seminar, and hopefully I'll see everybody there.
I'm looking forward to it.
All right. Bye, everybody.
Bye. Thanks so much.
As we wrap up today's episode of Electrolysis Unplugged, I want to bring this back to something simple but important. Melanated skin doesn't need gentler care. It needs smarter care. This conversation ties directly to the seminar that LaTrina is going to be doing at the Advanced Electrology Seminar in June this year, where we'll continue pushing for higher standards, better education, and more honest conversations within our profession. Thank you so much, LaTrina, for spending time with us today. If this episode sparked interests, by the way, you have questions or reflections, that's exactly the point. Feel free to submit your questions for your next episodes, and we'll see you next time on Electrolysis Unplugged.